In this lab, we're going to learn some concepts and practical skills for measuring vital capacity. So what we want to be able to do after this lab is understand what vital capacity is, understand why measuring it is important, and then to demonstrate the proper techniques and procedures for measuring vital capacity. Let's first make sure we know what vital capacity is. In the most basic terms, it's the greatest amount of air that can be exhaled, breathed out after a maximum inspiration, breathing in. Probably learned about all this in ex-phys already, so this ought to be a little bit of a review for you. In other words, after you blow out as much air from your lungs as possible, you take in as much as possible, then blow it out as much as you can. We may often hear of vital capacity being used interchangeably with forced vital capacity, so I want to explain this a bit. For this lab, I will be doing just that, using these two terms interchangeably, but we want to be able to understand that vital capacity is one of two things. It's slow vital capacity and forced vital capacity. Slow vital capacity, that's when we blow out as much air out of the lungs, but you guessed it, without force. Whereas forced vital capacity is blowing it out as quickly and forcibly as possible. Now, in normal subjects, there seems to be little to no difference between vital capacity and forced vital capacity. Now, normal vital capacities are between 3 and 5 liters, but I've also seen data suggest just over 2 liters and just over 5 liters. It all depends mostly on how old one is. How tall one is a really big factor, but weight, sex, and ethnicity can also play a role. Measuring vital capacity can help diagnose lung diseases that are obstructive, so things like asthma, emphysema, bronchitis is another one, and also restrictive diseases like idiopathic pulmonary fibrosis. And it can also help determine respiratory muscle involvement in neuromuscular diseases. In other words, vital capacity can be used as an index of severity of airflow limitation in a variety of conditions. And furthermore, it can also predict exercise performance in some populations, like the COPD. Now, a spirometer is the device that's used to measure vital capacity, and there are many kinds, but the older kinds used a drum with water housing a bell. They call it a wet spirometer. Excuse me. As air was drawn into the drum, the resulting change in the bell was recorded on a graph paper. Most spirometers in clinics and hospitals now are electronic, and they can cost up to several $1,000s. While these spirometers are not large and cumbersome, they are expensive, and so people don't really want to be moving them around so much. But there are also less expensive and more portable digital spirometers that can be used. You'll even see very simple spirometers that are used in hospitals and rehabilitation settings. And these have adjustable indicators that provide a target for when the client is engaged in their rehabilitation. They know what to shoot for, they know what to aim for. And these types, they're not used for measuring lung volumes per se, but instead they provide a means for exercising the lungs, diaphragms, and associated muscles too. Another type of simple, cost-effective, yet reasonably accurate spirometer is of the windmill type. And these are analog type spirometers, and a needle moves as the air is blown into a chamber. They're quite popular, and so this is what we're going to be using for this lab. Vital capacity is measured in cubic centimeters, cc's, or in liters. 1,000 cc's is basically 1 liter, so they're interchangeable. You may see it reported either way. You can see on the dial, each little mark between the numbers is 100 cc's, or a tenth of a liter. And the large marks with the numbers, they indicate a half a liter, or 500 cc's. The 0 mark is at the 7 liter mark, and remember we talked about normal ranges of vital capacity, upper values around 5 or 6 liters, remember that? So we'll almost never see anybody hit the 7 liter mark. Now I'll show you later how to twist the dial to zero it out before testing. Now here's a graphical illustration of your lung volumes. I'm sure you've learned this again in ex-phys, so let's just be a quick review specifically on vital capacities. Regular breathing, as you and I are doing right now, that's called tidal volumes. just breathing in and out while you're sitting, resting, and so forth. You're not purposely trying to breathe in any harder or breathing out anymore. Now, when you take a deep breath, a maximal inhalation at the end of a tidal volume, that is called inspiratory capacity. And when you maximally exhale after that, we have vital capacity. So when we want to instruct someone to perform a vital capacity, we tell them to begin a maximal inhalation at the end of a normal breath. And after that, and after they can't take in any more air as they're inhaling, after that they exhale as hard and as forcibly as possible for at least 6 seconds. Let's look at these procedures in greater detail. So patients, they should be instructed not to eat or drink anything that might affect their breathing, within an hour or so. Normally the things like caffeine and so forth, they're probably not going to have a really big effect on vital capacity, but it's good practice to keep everything standard. Patients, they should not have engaged in any kind of recent exercise or strenuous activity, within 1 or 2 hours. Again, same as what we find when we're doing other types of physiological measurements. When you're ready to take the test, we ask them to stand up. We need to make sure the spirometer is zeroed out, and then we want to hold it properly. So the windmill, it should not be held upside down. So the one that we're using should not be held upside down. Okay, it can be held to the side, it can be held upright, but not upside down. And I'll show that to you later. Then there are small holes. You may have remembered the illustration a few slides ago. There are small holes on those spirometers. You don't want to cover any of those up either. They shouldn't be covered up. So you just hold the base of it. After a normal breath, you just do a nice, smooth, continuous exhalation until complete. And then you inhale as much as possible. And you really try to fill those lungs with air. And then immediately what you're going to do is you're going to purse your lips firmly around the receptacle, and the nose is going to be pinched shut. And then you exhale rapidly and forcefully for a minimum of 6 seconds. Then you read the dial, record it. You do that 2 more times. And what you do is you take the best of the 3 trials. And after recording the values, the most common practice is to compare them with a normative set of data. Now remember, when you're doing this, to be sure the normative data that you're using is appropriate to the age, sex, and ethnicity of your patient. If you're a middle-aged adult, it's not wise to compare your values with an elderly person. It's just not going to make any sense to you. And these norms can be found in lots of different peer-reviewed research articles, and many of them are published. You could find these on the internet. Just make sure that when you're locating a norm that you're aware of where it's coming from and how they've been determined. All right, so let's just see a quick demonstration of what taking vital capacity looks like. So the first thing that we want to do is ask our clients some questions about their prior activity, prior eating, anything that might interfere. Remember to have the client stand up. Ready the spirometer, show the client what it looks like, the breathing apparatus, and explain to them how to reset the dial. When resetting the 0, all you have to do is just grab the spirometer at the base with one hand, and the other hand just twist the cap until the dial meets the 0 or the 7. The 0 and the 7 are the same things. Be sure that the holes are not covered when measuring, so we don't want to hold it at the tower here. Preferable to hold it at the base. Prior to measuring, the spirometer should be cleaned. The client will fit a mouthpiece. These can be plastic or cardboard, whichever comes with it or whatever's purchased. But that will fit right on the receptacle. So when you're ready to measure, have your client take normal breaths at the end of the second or third one. Inhale as much as possible. Pinch the nose, purse the lips, and blow, 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 blow as forcefully as you can for about 6 seconds. No, really no less than 6 seconds. Once you're finished, then you read the dial. In this case, we have about 2.2. Then you just reset it for the next trial. So you see it's down by the 0. Let's reset that a little bit better there, right on the 0 mark. So here we have trial 2, same thing, a few breaths at the end of the last one. Take a deep breath in, pinch the nose, purse the lips tightly. We don't want any air escaping from the nose or the lips. Blow as hard as you can for 6 seconds. Read that dial again. Looks like 2.1, about 2.1 there, 2.1 liters. Reset it to 0 for the third trial. And here's the third trial. So notice the technique. End of the last breath. Breathe in as much as you can. Pinch nose, purse lips. Blow, blow, blow for 6 seconds. Read the dial. Looks like we have 2.3 on this last trial. And then reset it to 0 again. As we're performing the trials, we want to record the data. So we remember we had 2.2 and 2.1 liters for the first. Now we have trial 3, which is 2.3. We take the best, not the average, but the best to indicate performance. Then finally, we're ready to clean it. So we can remove the tower from the base. This should not be screwed on too tightly, so it should be easy to come off. Then we just wipe any condensation with a paper towel. We get all that excess moisture out of there. Typically it's around the holes on the top of the ceiling of the tower and at the floor of the base there. Once we're finished, we'll discard that and we'll take some 70% isopropyl alcohol wipes and we'll do the same to disinfect it. We can remove the mouthpiece and discard that. And while we'll clean both the inside and the outside of the spirometer, it's always good practice, though, even though we clean it after, whoever will be using it next should clean it as well, just in case. Once it's cleaned, we can set it aside to air dry, if it needs to be, and then ready for the next use. And there you have it. Now you know what vital capacity is. You know why it's important to take vital capacity. And you understand the proper techniques and procedures for measuring vital capacity. Go out and have fun.